So sciatic nerve pain or sciatica, we get a lot of patients like that, especially as a chiropractic office. A lot of patients don't know what sciatica is. I think I'll go over that on a different video, but essentially it's just, it's a term meaning leg pain along the sciatic nerve distribution. So usually that's from the lower back and it goes down the back of the leg into the foot, okay? So a lot of things can cause that, from a disc problem to arthritis in the back to, heck, even a tumor can cause that. So the name of the game when we have this peripheral pain or pain traveling away from our spine is we want to start to bring it back up closer, or what we call centralize it. So we're going to use a philosophy called McKenzie approach from McKenzie Diagnosis and Therapy. One of the best things I can ever do for somebody with lower back pain is find a directional preference. Now, most people with lower back issues, especially sciatica, their directional preference is extension, and it makes sense, okay? We actually want people to go into end range lower back extension, well, because most of us sit in flexion all day, every single day. We drive in flexion, we're on a computer flexion, we sleep flexion. We hardly ever get to neutral, let alone end range extension. So basically it's your back starting to scream at you. So an end range extension standing, this is the most convenient. This is perfect for people that their pain isn't a 10 out of 10, you're functioning, but it's still annoying. We put our hands right here, so I got belt line, my hands are right above the belt line. Anatomically, we're at like L4, 5, S1-ish area. So what I'm gonna do is I'm gonna hinge over my hands and extend just over the hands. So the cues, I kind of bring the hips forward, so front of my hips past my toes, upper back past my heels, and I'm literally just trying to create it at my hands. A lot of patients you'll see this action, a lot of knee, or it's like, it's all upper back. They're basically hinging everywhere but their lower back, okay? So we get to here, hold for a second, and then we back off. We start with maybe about 10 reps, and you try to see what your symptoms are doing. So if it was going down the leg, now you do 10, you're like, kind of wiggle around a little bit, and like, I kind of just feel it up here. That's a good thing, okay? We're bringing it up towards the spine. If it goes further away, your foot's on fire, wrong direction, we got to reevaluate there. So that's standing, okay? Simplest way to do this. I can't tell you crazy how many people get better, how many plantar fasciitis cases get better. Now, let's say we want to do the alternative, which is a prone press up laying on our belly. Sometimes this is needed for people that have too much pain or they're a little bit more acute. So again, we're still working extension. However, we're taking gravity out of the equation and you get a little bit more control. So the people that are really flared up, I might just have them lay on their belly, which puts their back in a little bit of extension. And then as they're on their belly, as they get better, they can start to creep up. The key here is everything from here down has got to be shut down, shut off. It's got to be paralyzed. So if you have tightened muscles and as you're doing this, you're not going to get the full benefit. So the press up is basically, like I said, everything's relaxed. And then from here, I keep my hips on the table and I start to arch up. Get to a good end range there, and then I come back down. This turns into an upper body movement actually, or upper body press up, push up. But again, keeping my lower back totally relaxed. Same concept. So we do about 2, then we reevaluate our symptoms. So these are 2 exercises all based around end range extension. So we're getting our spine to extend backwards as far as we can, or end range, and we look for the change in the symptoms. The other caveat, when we start to do these, if you have a good response there and you feel better, we have to take away the bad positioning, which is usually flexion, okay? So if we start giving you extension exercises throughout the day, you also have to avoid the flexion. So if I'm sitting at an office chair, I will try to, extend here, brings my body up. This is where we start to give you pillows or a lumbar support to keep you more neutral. Same thing in the car, crank up the lumbar support in the car. If you're a side sleeper and you like to sleep in the fetal position and you wonder why you're so stiff in the morning, again, let's start to spend more time in neutral. We're simply reversing the postures we spend a lot of our time in all day. Okay, so McKenzie-based end range extension, go ahead and give these a try. You'd be surprised how much they can help you.